Here's your cervical thoracic resistance exercise for the acute phase. So we're going to start with our wedge position to pop their head up and make it a little bit easier for them. They're going to do their isometric zero flexion with the pressure at the forehead. Extension, they're just going to push back into the pillow. They can do rotation, the hand at the temple, side bend, same thing, head at the temple for your isometrics. Next, we're going to do the cranial flexion test, cervical cranial flexion test. We're going to use a blood pressure cuff for this one. Make sure that it's nice and tight on the where you pump it up. You're going to put the bladder there underneath their neck until it pumps to 20, which is going to be the bottom for most people. And then what you want here is as they tuck in, they should see that go up. So as they do their chin tuck, we don't want them pushing their head down. Their chin should come towards the chest, and it should create movement on the meter. And you're trying to get them just a little bit at a time. So resting should be at 20, and they do a little chin tuck, move it to 2, and relax. Move it to 4, 24, and relax. To 26, and relax. To 28. And relax, minding that they're using their deep cervical flexors and not their SCMs. And doing it here in this position is going to be a little easier than straight on the table. And differentiating those motions of a chin tuck, where they bring their chin towards their chest, upper cervical flexion, and lower cervical extension, that's their chin tuck. Upper cervical flexion, lower cervical extension is the chin tuck. The chin nod, or just a head nod, it's only your upper cervical flexion, just holding it there. Depending on what type of motion they're going for and what type of in their spine. You can progress this by having them do a posterior pelvic tilt, transverse abdominis, and then tuck. You'll see a lot of patients with neck pain when they tuck and use their core, their head will pop up off the table. So getting them to just stabilize that, it's going to be can be a challenge for some patients. And then keeping this motion while they're doing isometric or somewhere else, doing their isometric adduction, doing their isometric abduction or ER, going here and holding their scapular depression, and then chin tuck, or their scapular retraction and chin tuck at the same time. Incorporating those isometrics as the dynamic stabilization, or as simply just relaxing the head and getting them to relax. Sometimes they tense their neck so much that when they squeeze their shoulder blades, their head moves and their head pops up, and just keeping their head relaxed while they move their shoulder blades in directions that promote good posture, like retraction and depression. Or just getting their head to relax while they move their hips can be a challenge as well.